This is Pastor Dr. Tammy Washington, and I am here in Accra, Ghana. I am in the process of registering my NGO here, the Levon Resource Center. So I have the pleasure this evening of speaking with one of Ghana's finest, Dr. Eva, and she's a pediatrician here in Ghana, and I would like for her to just introduce herself and just give us a little information about herself.
All right, thank you, Timmy. My name is Evangeline Odukwe. I'm a pediatrician, as you said, in Ghana here. I work with the 37 Military Hospital as a pediatrician specialist, and I deal with a lot of children. I'm a mom of two. What else? I'm actually Nigerian. I'm a Nigerian trained doctor, but I also came down to Ghana because of family, and then got my accreditation with the Medical and Dental Council in Ghana, and so far I've trained to become a pediatrician. I think that's basically what it is about me. Like I said, I deal with children. I have a lot for children, and as Timmy rightly said, she's here to register her NGO here in Ghana, and I'm really hoping that we could do a lot together to help the underprivileged children here in Ghana. As we all know, it's a developing country, and we have a lot of shortcomings, especially when it has to do with children in Ghana. They actually are not able to speak for themselves. So if they have advocates who can always bring their cases on tables where people who matter actually sit, then I think their voices can be heard. And I think that's what this meeting is really about.
Absolutely. So awesome, great. So Doctor, can you just give us a little information and a little insight on some of the basic things that you see on a daily basis from children that's really in underserved children in the community, that things that they may need or what they lack or...
Okay, so for Ghana as a whole, I would say children lack almost everything.
Wow.
From the barest basic to, everything you think a child would need to grow adequately. From your basic amenities like water to lights, to a good sleeping place, to enough protection, security, basic food, not anything elaborate. It's really difficult for the very little Ghanaian child, or every Ghanaian child. But we have them in both extremes. We have those who have parents who can really afford for them. We have those in the middle class that also just struggle, hustle on a very daily to get something on their table. And then we really have the very less privileged ones. I have come across a lot of children who, like I said, they basically can't afford a thing. And when it comes to healthcare, it's a no-no. We are under-sourced, we are understaffed, we don't have a lot of resources that we work with here, so we are a country that work with very limited resources, even in our very, very big health facilities. So you can imagine everybody's competing for that very little space. Everybody's competing to see just that one specialist. And there's children who can't even speak for themselves, who don't even have the basic nutrition to thrive well, and they are still struggling with all of the whole country to just get the basic needs that they want. So from the basics, from water to good food, to school uniform, to a school shoe, a shoe to wear to school, books to even write with. We have, so when it comes to the health aspect, the country has really tried with the expanded program on immunization. So at least we have health centers that give vaccines for the vaccine preventable diseases. But in cases where ignorance and poverty plays a very, very high role, or where illiteracy also has a role to play, some parents do not even believe in some of these things that we preach. And it becomes really difficult because you have a child whose parent says no.
Yes.
And then you as a professional, you're there thinking that yes, this is what the child needs. And as a pediatric advocate, sometimes you just need to take over
Yes.
rights of the child and then
Mhm.
do what you have to do that is right for the child. But it's really difficult.
Mhm.
It's really difficult. So healthcare wise, routine care, sometimes even getting very little medications for just the smallest illnesses is a problem.
Mhm.
Getting investigations done when they are sick, and some of these parents will keep these children home because they don't even have transport to get
Wow.
to a good health facility
Wow.
or to even afford to see a specialist.
Mhm.
And they stay home, these children become very critical, and by the
Wow.
time they are coming, because I said we are very undersourced, we
Mhm.
work with very limited resources.
Mhm.
When they come in such critical cases or in very bad cases, there's also little that you can do for
Yeah.
them because you have the knowledge but you don't have what to
The
use to get
resources.
that
Yes.
across to the child. So they come, we do the best. Some of them go home, some of them, I mean, they do not survive. Some of them, even if they survive, they have some, loss of some maybe developmental milestones, or they don't just grow normally as they should have.
Wow.
So basic amenities, nutrition wise, education wise, health wise, children are lacking in all of those spaces.
Wow. Wow. Now you did mention that some of the parents are able to afford, but then there's the less privileged.
Yes.
And so how do you come across those patients? Do they just automatically come to your clinic, or do you have a clinic, or do they come to the hospital? Is it, how do you become in contact with those less fortunate, less privileged children?
So because I work in a tertiary facility that is open to all classes of individuals in Ghana, you have those class of people come in. I mean, there are times when you have very sick children come in, they don't even come in with a pesewa, they come in with nothing, and you have to do this. And then also for social responsibilities, I also try to reach out, like going out into the society, trying to meet with the needs of some of these children. We have some outreaches that we do, some organizations do that we try to support when they are doing some of their outreaches. About 2 weeks ago, there's a group that I'm on, and we had to do like a little contribution, and we went to a school somewhere in Accra here and just identified children who weren't wearing good school uniforms, who didn't have school shoes. And I mean, it was a great thing to behold, having to pay for their school uniforms, having to give them books, give them school bags, and all of that. So sometimes we go out looking for such children, and then there's also an outreach we do in church. You were with us in church today, so Christ Global Mission, an outreach that I try to put together for them, where we go to a very less privileged community in Dowenya, and then we have the children, we bring them together. We do more like basic medical screening for them, nothing elaborate, just taking their vital signs, asking pertinent questions, delving into the history of like their immunization history, delving into their nutritional history, examining them wholly, looking into their ears, into their throats, looking at their bodies to see if there are things that are of concern that mothers may not really understand, and then you just try to throw more light, educate mothers on how to take care of these children even better. And if you identify that maybe the child needs maybe some supplements or maybe extra care at the health facility, then you could do a referral or do a prescription for mothers to get whatever the child will need. So aside coming to the hospital to see us, I also go out to the society
and you
to
do
look
that.
out for.
You do that on your own time, outside of your regular
Yes, I do
duties?
that out of my regular duties. Yes.
Wow. So that's very courageous of you to do that. You must truly have a heart for people.
Oh yes.
Yeah, because it takes a lot. Because
Yes, it
I'm
takes
sure,
a lot.
Just with your daily, responsibilities at work, and then I've been in healthcare 38 years. I've never been a doctor, but I've worked with the best of them.
Okay.
So I know the stress, the wear and tear that the hours they put in, and everything. So to do something additional outside of that. Kudos to you, because that takes, true heroes to do stuff like that. So, and, at some point you all need to be rewarded, because it's not easy.
Yeah, it's really not.
It's not easy. And then trying to go out and find these children and somewhat be a, not a God but a savior for these children.
Yes.
These children are innocent. They have no one to
That's true.
really care for them. The parents do the best they can with the little that they have. And so, any additional help will help. So now, when you say that you go into the schools, now do you contact the schools first? How do you do that?
So you would have to contact the schools, tell them you are coming and the
Mhm.
reason why you would like to visit them,
Mhm.
and then they give you a go ahead and you
Okay.
just go.
Mhm.
You go and do what you have to do. We have I have greater plans,
Mhm.
not just to provide basics for them, but to
Mhm.
also do a form of health screening, because
Yes.
some of these children are living with things that we don't even know about.
Wow.
And just basic screening can
Mhm.
help you identify some of these children, and
Yeah.
you refer them to appropriate health care.
Yeah.
So they really do. Even the ones that you think can afford, sometimes the health seeking behavior of average African is really bad, it's really
Wow.
poor. So
Wow.
sometimes we pick up a lot of these things from just doing routine screening, maybe like
Yes.
mass screening, where you just identify a group of people and then you decide to just do a screen. You identify children that have eye issues, you identify children who have dental issues, you
Yes.
identify
Yes.
children who are anemic,
Yes.
who need iron supplements,
Yes.
you identify children who are malnourished, you identify
Wow.
those who are obese that may need some physical
Yes.
activity. Yes, so
Yes.
it's really important that
Mhm.
we go out
Mhm.
and do some of this screening as well. Yeah, I think basically, yes, basically.
Okay. So let me ask you this, because I know in the U.S., it's mandated that everyone has health insurance. Now in Ghana or in Africa, and I don't know as a whole, but in Ghana specifically, do they even offer health insurance?
Yeah, we have a national health insurance scheme.
Okay.
Yes, that is actually active.
Okay.
Yes.
Okay.
So basically, what it serves you in government institution may not be same as what it serves you in a private institution.
Okay.
But at least it's basic for you to get a national health insurance. Sometimes they run promos where you don't even need to pay anything to get on the scheme,
Okay.
and then maybe you continue doing your yearly contribution to have your status on the scheme active.
Okay.
So they do have, and I know that in some health facilities, national health insurance may pay for consultation totally, or sometimes may subsidize consultation. It may afford some lab investigations, it may not afford some, depending on what lab investigations that you're doing. It may also serve you some medications, but not. It doesn't cover. It doesn't cover all. Yes.
No.
So if you have a child who is chronically ill, who has a chronic medical condition, you advise them to get on the national health insurance scheme, because at least that would sort out consultation for you. Because one thing is to get someone to tell your problems and then have it at least half solved, than just sitting at home saying you don't have money. If you're on the NHIS, which is the National Health Insurance Scheme, at least you get the doctor to speak with. Even if it's not a specialist, you get somebody to talk to, and then it's taken up from there. So we do have a National Health Insurance Scheme that is quite active.
Okay, good. So with that, it's one would have to pay for it, or it would, for instance, if a child is critical and they don't have it, it is recommended that they get it.
Yes, it's recommended that you get it, but like I said earlier, it doesn't pay for everything.
It doesn't pay for everything.
Yes, it doesn't pay for everything. It can only just do some subsidy for you, but it won't pay for everything.
Not for all. Now, with that, do they have a pre-existing clause, meaning that if there's a condition that they had prior to obtaining the health insurance, will they still cover?
Okay, so for the National Health Insurance Scheme, unless for the private health insurance scheme, and that would depend on what private facility you are dealing with. Some of them actually go like extra mile to cover some expense for you. I don't think they put into consideration any risk that you bear or already. They just need you to get on the scheme and then do your keep your status active. And I mean, when the time comes for them to come in, they will. But even some of the private health insurance facilities would not give you. They won't pay for everything. Yes, so they have limited things. So like if you get into a hospital setting and probably you're on A health insurance and I am on B health insurance, when we get after seeing a doctor and you get to a pharmacy, you get to the pharmacy to get your prescription, health insurance A may afford you a generic medication, and then health insurance B can buy you like a brand medication.
Gotcha.
You see, so it depends on how much you are paying, on what private health insurance scheme you are using.
Yeah.
But if it's the national health insurance scheme that you are using, that one, I mean, the government supplies the hospital what medications they are going to give you, so you have that there. But for the private ones, they go a bit extra mile for their, but you pay more too.
But you pay more for that.
Yes.
Now, is that monthly or yearly, or how does that pay?
I think they do yearly payment for national health insurance schemes.
And do you know what it would cost for like a basic plan for a child?
For government, I remember the last that I was aware of a child being registered, it was 30 Ghana cedis.
Okay.
Yes, it was 30 Ghana cedis. I don't know what it is currently.
Okay.
I don't know what the private ones charge anyway, but it will depend on what plan you are going on.
Okay. Now, do you notice that a lot of the children, especially like the underprivileged, that they don't even have that basic one?
They don't have. So the underprivileged ones who actually need the national health insurance are not on the scheme. Yes.
Wow.
They are not on the scheme. Rather, the ones who can even afford basic care are the ones on the scheme. Probably is because of awareness.
Yes.
They may not know.
They may not know.
Yes, they may not know. And sometimes cultural beliefs, religious beliefs, social norms may also make them not want to come on the national health insurance. Yes. They feel it's a waste of time. I'm not going to get sick, so why do I get on the NHIS? Gotcha. So I'd rather just sit and wait till the day I die. Yes.
Oh, wow. Wow. Interesting. So like a basic consultation, what would that cost for someone that doesn't have anything?
All right, so for basic consultation, I think it's about 80 Ghana cedis to 120 Ghana cedis for the government health facilities. Yes, so if you are going to a moderate private health facility, it comes up to like 150 to 200. When you are going to the very high class ones, it could go up to as much as 250, 300, 450. In some places, you could be paying 800 Ghana cedis.
Gotcha.
Yes.
Okay. And then that's just for the consultation.
That's just for consultation.
And then there will be if there's additional tests or
blood work, labs that you have to run, X-rays, you would have to pay for those. You would have to pay for those ones.
Now, are those things do they have to be paid for prior to the service being rendered?
Unfortunately, yes.
Okay. So they don't do any billing. So like in the U.S., you go and you're sick and you don't have anything, they'll bill you. They'll do the services, perform the services, but then they'll send you a bill later.
Okay, so most hospitals here would actually run on cash and carry.
Cash and carry.
Yeah, so even if you're a critically ill patient who's been rushed into the hospital, I mean, they could do the resuscitation just to keep you alive, maybe within the first 24 hours, and they keep calling to see if any family member will come in. But if you've come in with family members and you're critically ill, you do a cash deposit. But this will work more for private facilities. Some government hospitals are beginning to adopt that, because at the end of the day, you have patients coming in after care, they don't have money to pay, and then the hospital keeps losing revenue. So a lot of hospitals are also adopting the fact that you may have to do some cash payments before, and that's even for your admission, so more like your stay in the hospital. But if you'd have to buy medications, if you'd have to do lab investigations, you have to pay upfront. You have to pay upfront. So you go do the payment, samples are taken and sent to the lab. If you don't pay, samples will not be taken.
So if you don't pay, you need the service, you don't get it. My God.
You don't get it.
Wow. So now at that time, are there any type of like outreaches and NGOs and stuff that's available, like say for instance at these hospital facilities, that they can say, okay, well I don't have the money to pay, and they can say, okay, well we can give you a referral to this place or that place, and maybe they can help you or give you a voucher for the services or the medication or the test that you may need. Are there any of those types of services?
Yes,
available?
So we have such existing, but sometimes you have people who walk in and say they want to help anybody who is in need. We have organizations too who walk in, come and give maybe like basic things, and also do some payments for those who are really in need. But sometimes they don't come all the time. We don't have them seated somewhere too that we just walk into their office and say, okay, my patient needs help.
Gotcha.
But when we have such cases, because we always have people coming to give funds to help the needy, so we have something called the needy fund.
The needy fund.
Yes.
Okay.
So sometimes when we know that it's really critical and we have to get this done, we can actually go to our peers
Okay.
and then get this done, and then we'll just keep updating with
Okay.
receipts. Yes.
Okay.
Some other facilities may have people that they reach out to,
Mhm.
or have NGO that actually
Work directly with.
them,
organization.
especially for children, like children living with cancers.
Mm-hmm.
They have a lot of NGOs supporting them.
Okay.
So sometimes when we get such cases, we may have to refer them to hospitals or link with some of these NGOs because they are really there to help. But I mean, the regular day-to-day seeing a child who really needs help and maybe doesn't have money to do payments for certain things. Sometimes we even bill our own pockets as caregivers. Yes, so sometimes you just have to tax everybody on the spot. Whatever you have, you just bring and let's do what. Sometimes we go to the needy fund if we still have funds in there. And then sometimes we have people working and we can also reach out to them. But the sad part is that sometimes some parents capitalize on that. Because they think that, oh, when I go here, if I don't have the doctors to do something for me. Yeah, so sometimes they just walk in. I mean, there is poverty, but we should try and be responsible parents. But we do have such people that really need that help. They don't have that money, and you can see that really they don't have that money. So when we get people who can actually do those things for us, yes, we reach out to them, and we always want to work with them.
Okay.
Yes.
Awesome. So just to wrap things up, just as a basic, what would, like, for instance, with my NGO, I'm resourced, and I come from, again, healthcare and pharmaceutical background, so I know basically all of the basic needs that's needed for the average per child or adult or whatever. So what do you think what would you benefit? What would you, for instance, what would be the basic things that you all would need? Would it be like certain medications? Would it be just funding? Would it be supplies? Or would it,
Okay, so that would depend on the population that you're looking at and in what setting you are looking at them. So if you are targeting a community, so what we do is that we go into the community and we communicate with them, we identify what their problems are, we identify their shortcomings, we come back to the table, we sit and we draw a sustainable plan for them. And then we identify those things, itemize them, and then we go back and give. So for example, if it's a community where you have a lot of children who don't go to school, or even have those who go to school but can't get basic nutrition. You get into such communities, you're going to find children who are malnourished, you're going to find children who are anemic, you're going to find children with some illnesses that maybe parents have never sought care for. You're going to find children who have never been dewormed. So like basic, very, very basics, yes. So you get into such a community, maybe you'd want, the first plan is maybe I want to deworm every child here that is under 12, or maybe say under 7 or under 5. Yes, you just get a particular age group, and then you get the number of children within that community. Let's say that's the project you want to do. And then you come back to the table, you've identified like 100 children, and then you go sourcing maybe with pharmaceutical companies to give you antihelmintics and maybe bring down the prices for you, and then you purchase, and then you go back to the community and give out. You've identified the gap, you've identified the need, and you've sorted that out. Now within the same population, you have children who are anemic, who may need some form of supplementation, or may have some chronic illnesses resulting in them being anemic. Now you have to give those supplements, and then you have to refer those who need health care to those facilities. When you are referring, if they don't have money, they will not go. So you may need to follow up that referral. Either that you are funding it up to the level where they're going to get the care that they need. Yes, and then get those medications or whatever will be needed in the course of that trip. Yes, so you follow it to the end to be sure that the child gets that help. And those in the community who can just benefit from iron supplementation, then you go back again to the pharmaceutical companies and get this at a very subsidized rate, then go back and then give, and maybe come back later to re-examine these children to be sure that you've met with that
Mhm.
with that need. So
Mhm.
medical supplies,
Mhm.
the basic things that you even need to do those examinations,
Mhm.
like very small equipment to do
Mhm.
your vital signs, to
Mhm.
check their weight, check their
Mhm.
BMI, check blood pressure,
Mhm.
a urine dipstick, a random blood sugar screen, a malaria, a
Wow,
quick
all of the
malaria
basic,
test. Yeah, so
very,
those very
wow.
basic things. So
Mhm.
you can get all of those ones. Then you go to their medical supplies,
Mhm.
and outside medical supplies, nutrition.
Nutrition.
Yes.
Yes.
So basic things, food
Mhm.
in whatever form you
Mhm.
can. So
Mhm.
yeah, carbohydrates,
Mhm.
some protein, in whatever form it can come.
Yeah.
It goes a long way to
Yeah.
help. So that's for community
Okay.
medicine, so to speak.
Mhm.
Now, when you come to the hospital facilities,
Mhm.
we have hospitals who have those amenities or they
Mhm.
have those infrastructure,
Mhm.
but they are not enough.
Yeah.
So
Yeah.
sometimes they may just need somebody to come support them.
Gotcha.
So maybe sometimes we have hospitals where their turnover delivery is like 40 babies a day.
Mhm. Mhm.
And then in this hospital, you
Mhm.
have maybe just 5 incubators.
Wow.
If you've got 40 deliveries, the chances that you may have 10 preterms is very high.
Mhm.
And if you've got 5 incubators, what happens to the other 5
That's
of the
right.
preterms?
That's right.
So sometimes they need those things as
Yeah.
well. So incubators,
Incubators.
to phototherapy machines.
Yes.
Yes, to even the baby courts.
Wow.
Yes. They
Yeah, I visited last week. I was in Kwaihu, and I had visit a clinic in Afram Plains and
Okay.
another area, and that was the thing that they said that they needed. Incubators.
The
had none.
incubators. They had
And
none.
they had none, and they were saying that they had just had a young lady that had triplets.
Wow.
Like a week before, and they had no incubators.
Wow.
Yeah, and
Sometimes you even have to share the incubators with
yeah. Wow.
multiple babies.
Wow.
Yeah, so cross infection and all that.
Yes.
So sometimes the phototherapy machine, because we don't have enough,
Yeah.
instead of having a child under phototherapy for a whole 48 hours,
Yeah.
you do them in turns.
Okay.
So this baby comes for 3 hours and you get out.
Yes.
And then another baby has to sit in for another 3 hours, and then
Wow.
you just keep
Yeah.
Just because
they don't
have, they're
they don't
really
have it.
undersourced. Yes.
Yes.
So just because they don't have.
Okay.
So it goes from the list.
Gotcha. I see. So
Yes.
wow, everything.
Everything.
Wow.
Everything.
Wow. Interesting.
Everything. And then for Africa, I think education
Yeah.
plays a whole
Oh,
lot of
absolutely.
role.
Absolutely. Absolutely.
Teaching the smallest of them all
Yes.
that these things are really necessary. So in
Yes.
as much as you are supplying their needs, you also have to create that awareness in their
Yes.
head.
Oh yeah.
Teach them
Oh yeah.
on the basic things, because even with the small things we have,
Mhm. Mhm.
we actually do a lot.
Mhm. Mhm.
So I think we can just build on that strength
Yes.
even more. And then when we get all those other things, then they become like
Yes.
excess for us.
Yes.
And that
Yes.
makes it better.
Yes.
And as much as we have our shortcomings, we are not doing badly
Yeah. Yeah.
when it
Yeah.
comes to healthcare. But it's just that sometimes we lose these children.
Oh yeah.
And it's really sad that you
Wow.
lose a child to a preventable cause.
Yes. Yes.
It really hurts.
Yes. Wow. I'm sure. Wow. 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 So, wow. You just, I knew you was going to say some of the things that you were saying, but a lot of the things that you were saying, I just didn't have a clue about how serious the issue is. And
It
so
is.
again, I'm looking to come and do the little that I have, and that I want to do. I'm looking to partner with physicians like yourself and hospitals and other facilities, and I'm looking to go into the underprivileged areas, because
Right.
that's going to be my target
Right.
for the underprivileged, the ones
Right.
that just
Can't even afford.
can't even afford anything. And so I want to be able, the NGO, to be able to provide the basic needs, and as so whether it's supplies, whether it's the money that's needed for insurance or for care or whatever the need is.
Okay.
Want to be able to.
Once it's identified,
Once it's
and then
identified.
it is to be
Yeah.
followed through.
Yes, and so I figured that the best way to do it is to sit down with someone like yourself, because you see these things firsthand. You work with it, you see what every day this is what you do. And so I wanted to say, I appreciate you taking the time out to sit with me, because again, I'm coming into the country. I know it, I could tell you just about anything about healthcare in the U.S., but coming to a whole nother continent, and I know that things are done differently. And so I just wanted to just sit down with a professional like yourself, just to get an idea. And just to see what the need is, so I'll know what to do on my end and what to target and what to go after. I do have a pharmaceutical background. I did work for Johnson & Johnson as well.
Right.
So, and I've been in healthcare 38 years. I ran a cancer practice. I've worked in just about. I worked for Children's National Medical Center for 8-9 years. So I've worked in just about every area. Of healthcare, and so I'm so I'm familiar. So I'm seasoned. I'm not entry level or just this is not something just new to me. I am now retired, so I am. Look, this is what my passion is. This is what how I want to live the rest of my life to do it. So God has opened up a door and made a way for me to be able to do exactly what what I want to do, what my heart desires. So I look forward to working with you, and I look forward to sitting down with you again one-on-one so that we can identify some of these things, one-on-one, hand-in-hand, on a more personal level, so that we can, you tell me where you think we should start, is in a relationship together, as far as building a partnership relationship or whatever, because I don't know. You know what's more critical than others. You know what takes precedence over other things. So we'll get together. I am due to come back here in April. But between my NGO is currently here. The one here in Ghana is currently being registered. So hopefully before I leave this week, everything will be up and running. I do have an assistant on here already that's going to be working already and looking into things. He's already reaching out to pharmaceutical companies. I've already told him the certain language to use, because I have that background, so I know exactly the limbo that's needed, the language that's needed to use. So he's already hands on deck with that. And then I just look forward to us just trying to, make the, world a better place. It's a little that we can do to provide. I mean, it's each one reach one. And so it's all of, we all do our little part. We can't save the world.
We can't save the world, exactly, but the little that we can do.
But the little that we can do, it will help and put a smile on someone's face.
Yes, and help someone achieve their dreams.
Exactly. That's what it's all about. That's my mission. That's a part of my ministry as well. I am a pastor as well, but that's also a part. I've always been mission driven. And I've always done missions. I've always had a heart for humanity. So that's what I do. And so again, I'm looking forward to doing more things together. We'll sit down again and have some more one-on-one personal time to get down to the root of what's needed. And then again, I commend you and your colleagues for just doing what you do in your profession, and then your spare time. You have your families and everything. So when you're out and you're doing for others, you're taking away from your family. So that's a lot.
That's a lot.
That's a lot.
We thank God for strength.
So we thank God for strength. So God bless you and keep you and give you the strength and the endurance to keep pushing and keep doing what you're doing and making a difference in the community.
Amen. And thank you too. Thank you for reaching out.
You're welcome.
Thank you for having that heart to help. God bless you richly. Thank you.
You're welcome. Okay. Okay. Thank you.